Could you enlarge on what you said about breathing into the pelvic floor, please? I said that there's lots of people thinking, right, I've got a new technique that I can use on men that they will find very effective. So how do we do it?
Yeah, absolutely. Oh, do you know, I just yesterday I had a patient. He'd had really immobile hips. He'd had to give up paddling. It was his passion. He couldn't move through his hips. He was getting increasing dysfunction. And this was the big game changer for him. And he was telling me about how he uses it now mountain biking. He said, I couldn't bike without getting really awful shooting pains in my adductors. And I do the pelvic floor breathing and I don't have any pain. So there we go. How? Well, I usually start either, depending on the person, it could be sitting or it could be lying down. I start with quick check breath like I did before to find out, not just for me, but for them to find out what is my habit. I encourage them first to breathe where it's easy to become aware of it. So if they're an upper chest breather, I get them to imagine there's a balloon inside them and that balloon doesn't just expand forward, but it expands backwards. I mean, they expand in all directions, don't they, balloons? And often people are only going up and they're not getting the full expansion. And once they get that, we move down, maybe to the diaphragm area. And then we move down to the abdomen area. And then we go down and we put the balloon in the pelvis. And as we breathe, we imagine that we're breathing our sitting bones apart and then they settle back in again. That's that posterior pelvic floor. In women, often I'll start with just feeling the pelvic plates, the ilia. And as you're breathing in, that balloon is expanding them. So they just allow for the expansion and they settle again. Of course, it's not like your bones are actually doing this, but what it's doing is it's changing the tensions. The other day I had someone, the most effective thing they needed was to actually breathe their little coccyx away from their pubic bone and create space in that dimension. But overall, I would have to say the breathing your sitting bones apart for men, for that posterior pelvic floor, can have such a profound effect. So yes, I would crack into that. Like I said, I could talk to you all day just about breathing techniques for different scenarios. But that's an easy one to see. Pardon?
We'd love that. And
Okay.
I've been pressuring you into getting back into the clinic here, where we can get a model on a treatment table and we can go through some routines which people can put into practice themselves.